Good evening, everyone. So I'll be talking about the new drug on the block. That's mainly the pilocarpine. So let's just start to understand what's happening right now. So basically, presbyopia is nothing but our physiological progressive loss of accommodation, which is again helping us having a difficulty to focus on our ears. So why this happens? So basically, your lens starts getting stiffened, your ciliary muscle and zonular weakness is there, which causing pupillary rigidity. So for a clinical relevance, we need to understand it's not only a lens issue, it's a combination of biochemical, optical, and your neural deficits. So your solution needs to be multimodal and it has to be individualized. It cannot be like a one treatment for all. We need to what does a 20/20 mean? That means basically it refers to our sharp distance for our driving, to see our screens, to do our daily functioning, to be accurate. N5 to be able to read newsprint at 33 to 40 centimeters. So basically the challenge here is to get the whole thing without compromising our contrast, stereo acuity, or inducing dysphotopsia. So how is this affecting our quality of life? Basically, we become frustrated when it becomes difficult for us to do our work. So this, according to our AO survey of 2023, almost 70 to 80% are facing that. We need to have non-invasive solutions. Basically, not to undergo the knife, not to go for an IOL, preferably which can be reversed, cost cutting. The cosmetic appealing, like we don't want to wear glasses. So anything which can give us a better way and not having to undergo much problem, that's what we want. Even especially with our multifocal contact lenses, where your distance is affected. So we need to, the quality of life, where right now after 40-45, where you feel you need to switch between your near and far, that is which is getting affected, which we have a problem. So currently, which we have the treatment options for a presbyopia ranging from our scleral based to cornea or the IOL based. So I'll be only touching about the non surgical aspects. Especially for the glasses, it's widely accepted as long as you're accepting it. The cons is usually you'll keep forgetting it, or you're dependent on the glasses for all that thing. Sometimes it's a cosmetic concern. Then again, frequently switching from year to year because of the change of glasses. Contact lenses, especially now with your multifocal, sometimes it's not like everyone accepts that. Dry eye being again a problematic. Sometimes it's again your depth being affected. So all this has to be kept in mind. Now in this, now all we'll try to do is the pharmacological correction, which is again having an upper hand. Why? Because you can use it when you want. You can switch between your glasses or your contact lenses. When you don't want, it is preserving your distance, and it's non-invasive. So currently, among all the things, pilocarpine 1.25% is the only US FDA approved. Other than that, the last month aceclidine has been approved there. So I'll be talking more about our Presview right now. Before I think in 2021, UET was introduced into the market. So Presview has already got a global approval status. So it's there in market since 2024. This UET was there by AbbVie in 2021. So pilocarpine is nothing but an alkaloid derivative. It's a muscarinic acetyl choline agonist. So how it acts, it basically constricts your pupil. So this gives you a pinhole effect. Invariably, it increases your depth of focus. So it makes your natural accommodation by improving your near vision without affecting your lens position. So as it is acting externally, there is nothing which is altering your lens or your corneal anatomy. So since there is a pupillary constriction and your ciliary body contraction, the shortening of your posterior zonules, so invariably your lens is swollen up and there is an increase in your AP diameter. So it has a dual action. By primary, it extends your depth of focus. Secondarily, it increases your amplitude of your accommodation. So I'll be talking mainly right now about the pilocarpine 1.25% study. The Gemini 1 and Gemini 2 clinical study, it was done on a group of patients which are to treat presbyopia who are undergone or not undergoing LASIK or PRK. This was almost done in the US. Almost around 300 patients were taken up. The age of 40 to 55 years. The duration was for 30 days with putting pilocarpine for once a day. So the conclusion of this was it improved your distant corrected near visual acuity with or without over undergoing your laser. So the final outcomes were the near and intermediate were improved, the distance was not affected. Virgo, in this study, it was like using pilocarpine twice a day. So this was at a gap of after 6 hours. So this was again done for around 230 subjects, around 45 to 55 years of age. So here also we concluded that near vision improvement was statistically greater with twice daily application of pilocarpine, and it didn't compromise your distance. So here in this study by Entod, we did a study to assess the safety and efficacy of pilocarpine versus a placebo. So this was done in 10 multi-centers with 234 subjects, 45 to 55 years of age, and all 100% completed the study. So this conclusion was same as Gemini, where 29.6% improved. What happens, which were included in the study, where around 45 to 55 years of age, they had to report any problematic problem which they were facing for your near. And the excluded patients were like more of a myopic power of more than 2 diopters, anyone having a peripheral retinal degeneration or any cataract or any other corneal abnormality. So this is how basically it went. The first you are screening it, then who were included, who were fulfilling the criteria were included into the study. So they were again valued at checked at day 3, day 7 and day 14, finally at the end of day 30. So each visit you are checking the mesopic high contrast, distance vision near acuity, photopic, and again you are checking the intermediate activity. So the primary endpoint, we got the result of as similar as Gemini, where 29.6% gained more than 3 line improvements by day 30 at 3 hours. So it significantly improved your near vision by 3 lines. So safety wise, 82% of the subjects had no visual problems, 11% had headache, a mild 3% had little amount of pain, irritation or hyperemia, which was negligible. So the primarily the summary of the study told that this multi-center told that 1.25% pilocarpine significantly improved your near visual acuity and a slight amount of your intermediate, didn't compromise on your distance. So this had actually a good little bit of effect for once daily using of your pilocarpine. So the real data tells us that 30% totally gained, more than 3 line improvement. It's usually the peak act in around 1 to 3 hours, and duration acts up to 6 to 8 hours. So in all the studies of Gemini, Virgo or this, it told that around 70% of patients were satisfied with this, but a light amount of broic or some things like a slight amount of irritation was observed in patient reading in dim lights. So we need to know that this is not like a one size fit all. We need to approach with caution. Each patient is different. You need to address it according to the patient with giving a good chair time. According to what their needs, we'll need to customize it. So we need to see again longer lasting formulations. We need to see again longer term study effects when you're comparing all the other factors too, especially again your aberration, your pupil size, your other aspects like your long term effects in the retina, when you have to compare all these things and to this. For the time being, right now what we have, it is giving you a good near and an intermediate. You can use it when you want. It's not affecting any other problem. It has a very negligible visual side effects, and it's basically unlocking a newer treatment approach for a most customized presbyopia approach. So thank you for your time.
Thank you, Dr. Shamanth. I think this is one eye-opener for all of us. I'm part of this Presbyopia Society since last 10 years. But people been, I think, talking, one of my friends from Colombia, he used to use this drug and never used to reveal that what kind of. Now we know that it is a diluted pilocarpine we all use, I think, because of its constricting property, I think. See, now what company people are... See, there are some side effects with this drug, like long-term results with the retinal detachment, and also there are long-term results with some patient complaining with some amount of a headache. But again, that is about the long-term. But how these companies are marketing, they tell that whenever someone is wearing the glass, suddenly if they forget about that, nowadays they tell them to carry this drop in their pocket. They just put a drop. The effect will be for 2 hours, 3 hours. They start seeing near. Like, whenever you require, you put the drops, otherwise you don't require. I think this is going to be the...
It's right now in this digital era where all of us, like, we want to use our phones or anything, and we are cosmetically like, when we want to go out, we don't want anything which we can like hamper our things. So this serves in that aspect like an easy way solution where you're using it once and it's having an effect for 6 to 8 hours, and that thing is managed. So in that aspect, it's a game changer. But yeah, like, we need to see the long term, like how frequently we can use it, how long term it's going to act. If when they are going to develop cataract, what is going to be the effect on pupil? Those all we need a very a long term this thing of the study.
Yeah,
Yeah.
you need the long-term results. Thank you so much.
Thank you.
So now I invite one of my close friend, Dr. Gaurav Luthra, prolific phaco-refractive surgeon from northern part of India, that is from Dehradun. He has been, I think, the few early user of these phakic lenses. He'll be sharing about his personal experience with one of the Indian company, that is IPCL from IOCare. Over to you, Dr. Gaurav.
Thank you so much, Dr. Kudlu, for inviting me, and very good evening to everyone.